Hi everyone, my name is Nicole Welps. I'm the coordinator for the Joint and Spine program here at Monmouth Medical Center. On behalf of our entire team, welcome and thank you for choosing Monmouth Medical Center for your upcoming spine surgery. Please note that this class will be very generalized, so we do suggest that you still come to an in-person class during your scheduled pre-admission time at Monmouth Medical Center. If you do have any questions specific to your surgeon or any questions in general, please call me or email me about absolutely anything. I do work closely with your surgeon and can answer the majority of the questions that you have. My phone number and my email are on slide 3 in your packet. Now, some things to get done prior to your surgery. If your surgeon wants you to get a clearance appointment from your primary care doctor saying that you're healthy enough to be having this surgery, they're going to be using the results from your pre-admission testing completing at Monmouth Medical Center. It takes us an average of 2 to 3 days to get the results from here to your doctor. So give us about 2 to 3 days after your pre-admission testing appointment to make those appointments with your primary care doctor as well as any other physicians that your surgeon wants clearance from. Now, medications I need you to stop. These are important. There are many medications that you need to stop coming into your surgery. Your surgeon is going to send you a packet, and in that packet will be a list of the medications that he wants you to stop coming into surgery. But as a rule of thumb, at least 1 week prior to your surgery, you need to come off of any anti-inflammatories or NSAIDs. NSAIDs are Motrin, Advil, Aleve, Celebrex, Meloxicam. You cannot take the week before your surgery. Now, if you can't take any anti-inflammatories for pain, what can you take? You can take Tylenol or generic acetaminophen up until the day of your surgery, and you can take something stronger. So if your surgeon's ever prescribed you tramadol or Percocet, oxycodone, a muscle relaxer, or something for nerve pain, those are all fine. It's only those NSAIDs like Motrin, Advil, Aleve you cannot take. Doctors also like you off of anything with vitamin E in it. So if you're on a multivitamin, we like you to stop that multivitamin 1 week prior to your surgery. If you take some vitamins separately like calcium and D and C, those are all fine. It's just the multivitamin that we don't like because of the vitamin E that's in there. And lastly, any fish oils or any herbal supplements. So if you take anything herbal over the counter like turmeric, please stop it 1 week prior to your surgery. We also like you to stay off of any NSAIDs after your surgery, such as Motrin, Advil, Aleve. Not only do they thin your blood, but they've been found to inhibit your new bone graft from fusing. So just like before surgery, when you leave the hospital until your surgeon gives you the okay, the only thing you could take over the counter is Tylenol or generic acetaminophen. If you've been prescribed a blood thinner like Coumadin, Xarelto, or Plavix, please defer to what your cardiologist or primary care doctor agrees on with your surgeon on how far before surgery you need to stop that blood thinner. Now, how long can you plan on being in the hospital with us? Most cervical fusions stay just 1 night. Sometimes you'll stay 2 nights depending on your surgery and the amount of levels that you're getting fused. Keep in mind that discharges on the weekend happen exactly the same as they would on the weekday. You could still go home with any necessary equipment or prescriptions that you'll need after the surgery. Keep in mind that the day of surgery is considered post-op day 0. It does not count as a day for us. So if your surgery is a Monday, Monday is day 0, Tuesday is day 1, and Wednesday is day 2. Now the surgery itself, what can you expect them to be doing during the surgery? I like to draw it because it gives you a better idea of what they're going to be doing and why you have some restrictions after your surgery. So, you have your vertebrae. We'll say C3, C4, C5. And in between each vertebrae is a little disc. And what's causing the numbness, pain, weakness down the arm is that disc can be herniating and pressing on the nerve, or the disc is just so run down that you're bone on bone on that nerve, creating all those symptoms you're coming into surgery for. So what is your surgeon going to do? He's actually going to remove the disc completely from between the vertebrae, but he's going to replace it with a little cage, or some doctors call it a spacer. They're going to fill that cage or that spacer with bone graft, which will eventually fuse, which is why we call this a cervical fusion, with your vertebrae, creating one big one so there can't be any movement there to press on the nerve. However, it could take several months to get a solid fusion, which is why we have to put hardware in there. We're going to put a plate, or some doctors call it a rod, and screws. So really, it's the hardware that holds it together as that fusion is ultimately fusing. So that's why there are some restrictions after surgery. We really want to let that heal before we start doing too much movement. A common question is about that hardware. Does the hardware come out? No. That hardware is meant to stay in for life. There is no second surgery to remove the hardware from the neck. Most commonly, this surgery is an anterior approach, which means they're actually going to go through the front, and they make about a 2-inch incision to the right or to the left of the neck. Now, what to pack? What do I want you to bring with you to the hospital? All I need you to bring is one pair of loose-fitting clothes with you. Keep in mind that you'll most likely have a collar on after your surgery, so please don't have anything too tight on the neck. Bring something button up or zip up, and then just a loose-fitting pair of pants. Most people use our cute little yellow socks while they're here in the hospital, but bring a nice loose shoe to go home with. You could bring your toiletries like toothbrush, toothpaste, deodorant to get up and washed while you're here in the hospital. I do want you to bring back your incentive spirometer, which is this little breathing machine you're going to get during pre-admission testing at Monmouth Medical Center. If you have sleep apnea and use a machine, please bring it with you to the hospital with all your settings programmed in it. And our TVs are already turned on for you, but we also have free Wi-Fi on the floor, so feel free to bring your cell phones with the charger, tablet, something to do during your downtime while you're here. Now that's what I do want you to bring. What I don't want you to bring is medications. Please do not bring your daily medications with you to the hospital. All we like is a nice list so that we know which medications to give you while you're here. Now, physical therapy. If you get up to the orthopedic unit before about 3 or 4 o'clock, don't be surprised when the physical therapy team comes to your room that day to get you up. If not, the nurses can get you up. You could really get up and out of bed as soon as you feel up to it after this surgery. Each day while you're here, you can have up to 2 rounds of physical therapy. We have a gym that's on the orthopedic unit, and they'll bring you down and work with you one-on-one until the therapists feel you're cleared from services and safe to go home. Now, physical therapy after spine surgery is not really what we think of physical therapy as. It's not too much movement and stretching and strengthening exercises. It's more occupational therapy. So really what we'll be teaching you are your restrictions and how do you go home safely without breaking those restrictions. Another thing that we'll be doing with you during therapy is walking. A large amount of your therapy after this surgery is walking, and there's actually no restriction on how much you walk after this surgery. Now, as far as your precautions go, what do you want to avoid during or after this surgery? For the first at least 2 weeks until your follow-up visit with your surgeon, you want to avoid any extreme movements of the neck. So you want to avoid any stretching your neck right or left, down or up. You want to avoid. You also want to avoid any lifting more than about a gallon of milk. So really, no lifting other than day-to-day, getting your coffee, making something to eat or drink, but no lifting more than about a gallon of milk. And avoid arms over 90 degrees. So that really means you want to avoid grabbing something off a top shelf. You could still wash your hair, that's fine. You just don't want to reach above you to grab something. So those are your restrictions. No extreme movements of the neck, no lifting more than about a gallon of milk, or arms over 90 degrees. There is no restriction, though, on walking, okay? Now, stairs. Stairs are also fine to do after your surgery. The stairs are not breaking any precautions. However, you won't feel up to going up and down them 5-7 times throughout the day. So set up your house so that you have everything that you need on one level, so that you really need to limit the amount of times that you go up and down the stairs. As far as sleeping goes, sleeping is often something you need to modify after this surgery. Whether or not your doctor uses a collar, you're going to notice you're going to want to sleep on an incline. So a lot of people feel more comfortable sleeping somewhat sitting up, whether that's a recliner, a couch, or prop a lot of pillows behind your back is always the easiest way to sleep. So prepare for that when you go home. Now, some homework assignments for you. You're going to get an incentive spirometer in pre-admission testing at Monmouth Medical. This is so important for you to use before and after your surgery. I'm sure you've heard of people talking about getting pneumonia after surgery. The reason why that's even a possibility is because after your surgery, you tend to lie in bed a lot more than you normally do. Especially with an incision on your neck, you don't take big, deep breaths. And if you don't take big, deep breaths, you could get some fluid buildup on the lungs, which could cause a fever and eventually pneumonia. And John is going to demonstrate how to use your incentive spirometer.
All right, so this is your incentive spirometer. And if you notice, these little devices go up and down. I don't know if you can see that clearly, but this white indicator will come up as you're breathing in. And there's also a little yellow indicator which will go up as you're breathing in as well. There's also a little arrow device that slides up and down on the side here, okay? Now, this comes with, of course, instructions. And the instruction sheet in the center has two charts, one for males and one for females. And what it does, it tells you what to set this arrow device on as a goal. All right, so I just, you look up your height and your age, and it will tell you what setting to set it on. Mine comes out to 2,000, so I'm going to set this at 2,000. And when I do the exercise, I need to try to get to at least 2,000 or better, okay? Now, the trick is you want to breathe in slowly. You don't want to breathe in too rapidly because you're really not extending your lungs. Like that, that's really not extending your lungs. You want to breathe in nice and slow. All right, so you're going to suck in on this tube like you're sucking in on a straw, okay? You do not blow into this. You want to breathe in on this tube, all right? Now, this white indicator is going to come up, and it's going to come up to hopefully where my goal is, or better. And this yellow indicator will come up as well. And there's three settings here, and it says best. You want to keep it in the best area. The top of the yellow indicator will be at the best area, and the white indicator you want to get up to the arrow. Okay? Again, like I said, you want to breathe in slowly. When your lungs are totally full, you want to hold your breath for 3 seconds and then release it slowly. All right, let me just demonstrate. That's probably going to be the easiest thing to do. All right, so like I said, I'm going to breathe in slowly. I'm going to hold my breath for 3 seconds and then release it slowly. All right, so I got to 2,500, above my 2,000 mark, which is good. And don't be alarmed when you first start doing this if you don't quite make your goal. Continue doing it, and eventually you will get there. All right. Now, everybody will start 3 days before you come to the hospital. You're going to get one of these things when you come in for your pre-admission testing. All right, so you're going to do this at home, and you're going to do it 3 times a day, 10 times an hour, okay? And I'll explain it. I like to say after breakfast, lunch, and dinner. After breakfast, take 10 inhalations within 1 hour. Don't you take 10 in a row because that could get you a little lightheaded, and that's no good. So take 2 or 3 inhalations and then pause about 5 minutes and take another 2 or 3 inhalations and pause another 5 minutes or so, as long as you do 10 within the hour. Then in the afternoon, after lunch sometime, do another 10, and then in the evening, do another 10. Okay, that's the minimum. You could do more if you like, but you need you to do it at least 3 times a day. Bring this back to the hospital with you when you come back for your surgery. You're going to be using it here in the hospital as well. If you forget it or if you lose it, if you break it or anything like that, don't worry, we have plenty here. But when you come up from surgery, you're going to be doing this again 10 times an hour. The only difference is you're going to be doing it every hour that you're awake. All right? We won't wake you up in the middle of the night to do it, but you're going to be doing it all day long, and it's extremely important that you do this. Like Nicole said, if you don't, you could wind up with fluid on your lungs. And the worst case scenario would be pneumonia. And if the very least, you could get a fever. And if the fever is high enough, you're going to wind up spending a couple more days in the hospital. So it's called your incentive spirometer, or an IS. Most of us just call it a puffer.
Another piece of homework for you is we like you to get on a stool softener prior to your surgery. One of the most common side effects of general anesthesia as well as narcotics is constipation. So we do suggest that you take a stool softener 3 days prior to your surgery, not including the morning of. A daily stool softener like Colace is a good one to take to stimulate the gut to prevent you from getting constipated after your surgery. You're going to need to purchase that stool softener for when you go home anyway, because whenever you're on a narcotic, you need to be on a stool softener. So 3 days before, start that incentive spirometer, and 3 days before, start that stool softener. Now it's the day before your surgery, so I've been practicing my breathing machine, I've been taking my stool softener. Now it's the day before. If your surgery is a Tuesday through a Friday, you'll get your phone call the day before. If your surgery is a Monday, you'll get your call the Friday before. Please keep in mind that that phone call comes after 3 p.m. So it's not until a little bit later in the day that you'll get your call on what time you need to come in. The earliest OR time is 7:30 a.m., which means the earliest you'd have to be here is 5:30 a.m. We like you here 2 hours prior to your scheduled OR time. If you have any questions on what time you need to come in, best number to call is on slide 13. Now, after you get that phone call on what time you need to come in, it's time to cleanse before my surgery. So you are going to get wipes in pre-admission testing. They're going to look like this, one big set with 3 and a single set. These are called chlorhexidine wipes. They're one of the many things that we do to prevent you from developing an infection after this surgery. You're going to get an instruction sheet on how to use these wipes, but all you're going to do is shower normally the night before your surgery. Shampoo, body wash, conditioner, whatever you normally use. Get out of your shower, dry off completely, and wait about 2 hours. After 2 hours, you're going to take out your big package of wipes and wipe down your entire body from the neck down, about 2 hours after your shower. After that, you do not shower. So you don't shower the morning of your surgery. All you do is take out your single set of wipes that you'll get and just wipe down your surgical site. So just wipe down your neck and your chest right before you come into the hospital. Please avoid any lotions or perfumes the morning of. If your surgeon told you to go out and buy a body wash, or he provided a body wash for you, please use that instead of the wipes. Now, everyone's going to be swabbed for MRSA while they're in pre-admission testing. They're looking for a bacteria that can cause a staph infection. If you do test positive for that swab, don't worry. A large majority of patients do. And if you do test positive, it's going to be your surgeon's office that calls you and calls in an antibiotic that goes in both nostrils 5 days prior to your surgery. If you test positive, the instructions on how to use that ointment will be in your pre-admission testing packet. If you test negative, nobody calls you about it. So if you test negative, you're just doing your wipes the night before and morning of surgery. Now, after midnight, the day of your surgery, you're going to be nothing by mouth after midnight except your approved medications with a small sip of water, and that's it. Other than that, no eating or drinking. Remember, you're not taking a full shower. You're just using those wipes on your neck and your chest before you come into the hospital. When you come to the hospital, come towards the main entrance. You could park in the parking garage or valet your car, which will lead you to the front desk. When they ask you where you're going, just let them know you're heading up to the operating room. Our operating room is on the 4th floor in the Todd wing. So it's the Todd elevators, the 4th floor. When you get here, you're going to meet your entire team. Your surgeon will come out to greet you before you go into the operating room. How long your surgery will last will vary by surgeon and by how many levels you're getting fused. Your family can not meet you in recovery room after your surgery, but they'll be meeting you up on the orthopedic unit, so we'll be communicating with them throughout the surgery to let them know when they can meet you there. You will be going under general anesthesia for the surgery, which is why it is so important to 1, use your breathing machine, and 2, have a stool softener for before and after your surgery. When you wake up in recovery room, what can you expect? You're going to most likely, not everyone, some patients will wake up with a pain pump. So if you wake up with a pain pump, it's going to look like a little button here, and your nurse will say you could press this when you feel like you need a small dose of pain medication. You cannot give yourself too much. It will always lock itself out, but it's patient controlled, so you're in charge of when you press it. If you are connected to a pain pump, they'll take it off the next day before they transition you to oral pain medications. As far as medications go, what can you expect for pain? You usually have 2 types of pain medications, which is why we commonly send you home with 2 types of medications. So you're going to have some obvious pain, the incisional pain where they made that cut on the neck, which we like to usually send you home with something like oxycodone or Percocet for. But you're also going to wake up and you're going to say, you know, it's odd because although my throat really hurts, my back is bothering me. So you often get pain in between the shoulder blades after the surgery. The reason why is the positioning of surgery puts your shoulders back. So you often get some chest and shoulder pain. So we often like to send you home with a muscle relaxer, something like Flexeril or Valium for that. Again, it does vary by surgeon, but those are often the medications that you go home with. Remember, while you're on those pain medications, please be on a stool softener like Colace to counteract the side effect of constipation. And also, when the narcotics become too strong, we're avoiding any anti-inflammatories like Motrin, Advil, Aleve, only Tylenol over the counter until your surgeon gives you the okay. Now, the collar. It will vary by surgeon if you have a collar on. So it is surgeon specific if you have a collar on. How long you need to wear the collar, again, is surgeon specific, and it depends on the levels you're getting fused. So if you do have a question on the collar, your surgeon is the best one to defer to. So if you have a collar on, the most common one that we use looks like this. So just some tidbits of advice for this collar. It's going to have 2 Velcro straps here. Once you adjust it well to your neck, only undo one side, open it like a clamshell. Don't keep undoing both Velcros. If you have this collar here, it has a button. This button can actually be pulled out and adjusted better to your neck so that you feel comfortable. You want this collar to be looking straight, your chin looking straight. You shouldn't be up or down. So I'm going to demonstrate on John. Thanks, John. We're going to put it right underneath his neck here. We're going to wrap it around and use his collar. Now you want it pretty tight. You want it tight enough that you can't wiggle your neck, but you want it loose enough that you could still fit 1 to 2 fingers in between the collar and the chin itself. Now, this collar, remember, is on all the time except in the shower unless your surgeon says differently. With this collar, your biggest modification is sleeping. So remember, on an incline is normal to have to sleep. So recliners are great, and if you don't have a recliner, a couch or a lot of pillows behind your back is usually more comfortable to sleep with this collar on. When I take it off, I'm just going to undo, remember, one side and then wrap it around. Thanks, John. Now, we will also send you home with collar pads. These pads that are in here now can actually be removed, and you can put new collar pads in there. So if you get it dirty or sweaty, you could put your new collar pads in there. You could wash them with soap and water and let them air dry. The only one that people tend to make a mistake on is this back piece here. So with this piece, you could see how the Velcro goes through here. If you're changing this, once you remove this one, when you put a new one on, make sure you still Velcro it through. So you have to loop it through here and then put it through the loop like that. So don't leave it dangling. You want to loop it through and then slide it through this point. And you'll know it's the right side up because it's going to say Vista. So that's how you know it's the right side up. So we'll send you home with extra collar pads. You could wash them with soap and water and let them air dry. Now, a drain. Some patients, not all, but some will wake up with a drain coming out of the incision. The drain that they would use would look like this, and the goal of it is to prevent any blood or fluid that would be accumulating around the incision and puts it into this drain. Now, you will not go home with the drain. So if you do wake up with one, it's only while you're here in the hospital, and it will be taken out before you leave. Now, the nursing unit that you're going to be on while you're here in the hospital is called TOD. It's the TOD Elevators 6 East. So it's TOD Elevators 6th floor. Remember, we have the gym on the orthopedic unit. Well, they'll bring you down for physical therapy, working on teaching you your restrictions and going about your day-to-day activities without breaking them. As far as when you go home, your diet is going to need to be modified. So our 2 modifications, sleeping and your diet. Your throat's going to hurt. This surgery seems more for most people like a throat surgery as far as pain goes than it does for spine surgery because you're going to have a very sore throat. So you're going to need to be on soft foods for the first, usually about 5 to 7 days, although that varies by the patient. And when I say soft foods, I want you to avoid any dairy while you're doing that. So avoid too much dairy. The reason why is that you're going to get phlegm after this surgery. Phlegm is normal, it's expected. Anytime we irritate the throat, we tend to get some phlegm. So the worst thing you could do is go home, start eating milkshakes and ice cream all the time. It's better to have things like soups or oatmeal, sherbet, Italian ice, more water-based foods than high in dairy content. So you want to do soft foods for the first 5 to 7 days until your throat's feeling a little bit better. Just a reminder, even after the surgery, if you feel pretty good, never get up without a nurse until you're cleared so by physical therapy. After this surgery, you are considered at a little bit of a higher risk for developing a blood clot in the first several weeks. If you do ever develop a blood clot, it would start in the back of the calves. And the calf could get big, hot, red, swollen, and painful. If that ever happens, you call your doctor immediately. But we do a lot to prevent blood clots, which is why we really never see them. You're going to wake up from surgery with these cute tights on your legs. They're called compression stockings. They go on during the day. They come off at night while you're here in the hospital. But as long as you're up and able to walk, we could take these off when you leave and you don't need to go home with them. You'll also wake up with these wrapped around your legs. They're called Flotrons. They attach to a little machine at the bottom of the bed and pump air in them to keep everything circulating while you're in bed. Again, you won't need to go home with them. You just want to make sure you're up and walking when you're home. Now on discharge day, which will either be the day after surgery or 2 days after, I'll come to your room and we'll do discharge instructions together. But some common questions that I get calls on is, when can I shower? A good rule of thumb is 3 days after your surgery, you are allowed to shower. Some surgeons let you shower sooner, but 3 days is a good rule of thumb. If your surgeon wants you to cover the incision after you shower, we'll give you the gauze and tape to go home with so you could change it every time after you shower. Your doctors are going to use a glue to close the incision. That glue will just harden and dissolve on its own. Remember, when you go home, there's 2 big modifications after the surgery. Even if you don't have a collar on, sleeping on an incline and your diet are the 2 things you really want to focus on after this surgery. Also, please have that stool softener for when you go home, because whenever you're on the pain meds, you need to be on that. And have a big bottle of Tylenol for when those narcotics get too strong. If you do have any questions on the material that we reviewed, please do not hesitate to call me or email me. Again, my phone number is on slide 3. And if not, I look forward to seeing you while you're here. Thank you.